Cardiovascular Pharmacology, Digoxin. All right, so before we talk about digoxin's mechanism of action, we kind of have to cover the normal physiology of what occurs at the cardiac cell, okay? So to begin with, right, we have the sodium-potassium ATPase pump, okay? So we use an ATP to pump potassium into the cell and sodium out of the cell, okay? This is normal physiology. And then that sodium that's outside of the cell then comes back into the cell via the sodium-calcium exchanger, okay? So as sodium gets put back into the cell, calcium gets pushed out, okay? So that's the whole mechanism that you need to understand, is that the sodium-potassium pump works, and then it exchanges that sodium, it pushes sodium out of the cell, and then the sodium-calcium exchanger pushes sodium back into the cell, exchanging for a calcium out of the cell, okay? So what digoxin does, it blocks the mechanism of the sodium-potassium ATPase pump. And so what that does is that it leads to a decrease in potassium intracellularly, right? Because now that we have the sodium-potassium pump no longer working, it's inhibited by digoxin, we have an overall decrease in potassium intracellularly, okay? So there's no longer potassium being pumped in by the sodium-potassium pump. And we also have sodium being trapped intracellularly. So we have an increase in sodium inside that cell because we don't have the sodium-potassium pump pumping sodium out of the cell. So we have a rise in sodium in the cell, and we have a fall of potassium in the cell. Okay. And then lastly, because sodium can no longer be pumped out by the sodium-potassium pump, that means that the sodium-calcium exchanger can no longer use sodium to pump calcium out of the cell. So we have an overall increase in calcium intracellularly. Okay, so does that make sense? So overall, we have a drop in potassium, a rise in sodium and calcium, all inside the cell. Okay. It's very important. They love to ask about that. So make sure you understand that. And that rise in the calcium inside the cell is going to lead to positive inotropy. So it leads to an increase in contractility, because if we have more calcium, that means we have more contraction, harder contractions, okay? Very important. It also stimulates the vagus nerve, which leads to an overall decrease in the heart rate. Okay, so those are the two things you have to know. So the first thing is potassium drops, sodium and calcium increases all intracellularly, okay? Leading to an increase in contractility. And then it also stimulates the vagus nerve, which leads to a decrease in heart rate, okay? Understand that, and you're going to be golden. That's the mechanism of action of digoxin, okay? And the reason we use dig is for heart failure, in order to increase contractility of the heart, right? So if the heart is failing and we need kind of the pump to pump harder, we're going to give them digoxin, okay? Now, the adverse effects are very key to this, okay? The adverse effects are cholinergic effects, so you're going to see like GI side effects like diarrhea, nausea, vomiting. Those are cholinergic side effects, okay? But the one that really is high yield is blurry yellow vision, okay? And they know that they call that xanthopsia, okay? So blurry yellow vision is called xanthopsia. And so if you ever see a patient that has yellow vision or changes in the color of their vision, that is sometimes digoxin. We're going to see other medications that can also cause blurry vision or changes in color of vision. You'll see that later on. But for right now, if you see blurry yellow vision, xanthopsia, then it's digoxin's the cause, okay? There's also importance. It can lead to hyperkalemia, okay, which indicates a poor prognosis. And the reason behind that is because what do we say? We have a drop in potassium intracellularly. So that means all the potassium is rising extracellularly. So it causes a hyperkalemic state, okay, which isn't good, right? Because it could lead to arrhythmias. So this is why it is a pro-arrhythmic drug. So we have to worry about it, okay? And then two other things that they might ask about is that it can lead to renal failure and hypokalemia overall due to the fact that it has dig binds to the potassium binding site on the sodium-potassium ATPase. But to me, that doesn't matter. Just focus in on the mechanism of action for dig and that blurry yellow vision with the potential hyperkalemic effects, all right? That's all for dig.